All right. Well, good morning, everyone. Thank you for joining us. My name is Tom Shanley, and I have the privilege of serving as President and CEO here at the Ann and Robert H. Lurie Children's Hospital of Chicago. And on behalf of all of us across our entire medical center, welcome and thank you for joining us for this important event. Lurie Children's is a unique institution with a very distinct vision. As the state's only independent academic acute care children's medical center, our vision is to be a transformative force across our multi-pillar mission of clinical care, advocacy, research, and education to achieve a healthier future for every child in the state. Fulfilling this vision necessitates that we work in genuine partnership with policymakers every day to promote optimal health and well-being of our children by ensuring that they have access to the care they need, when they need it, at the right place and the right time. However, contraction of inpatient pediatric beds, a diminishing pediatric specialist workforce, and other administrative barriers are making this increasingly more challenging in pediatrics. And that is why we're honored to welcome Governor Pritzker, an extraordinary leader on behalf of Illinois' children and families. And he's here today to discuss the Healthcare Protection Act. We applaud his leadership on this important legislation that, if enacted, will protect our patients and families by increasing their access to both specialty and behavioral health care. Governor Pritzker is also a champion for the Medicaid program, the single largest insurer of our nation's children. This is critically important to Lurie Children's because Medicaid is the cornerstone of child health care across America. And we are honored to partner with the state of Illinois in serving more children insured by Medicaid than any other hospital in the state. We're also honored to have Lieutenant Governor Julie Stratton join us today. And I also want to welcome our own state senator and birthday boy, Robert Peters, as well as state representatives Ann Moeller and Cam Buckner. And finally, also a special welcome and thanks to A.J. Wilhelmy, who is President and CEO of Illinois Health and Hospital Association. Thank you all for joining us today. And now it is my distinct privilege to turn the podium over to our Governor, J.B. Pritzker.
Well, good morning, everyone. Thank you very much to Dr. Shanley for welcoming us to Lurie Children's Hospital today. And before we begin, I want to say thank you to Lurie's healthcare professionals for the outstanding care that you provide to your patients and the comfort that you bring to parents when their children's health is at risk. Lurie sets a high standard for patient care that hospitals across the nation, frankly, only hope to emulate. So thank you for the work that you do here. We're here today to highlight the Healthcare Protection Act, a bill that, when passed, will curb predatory insurance practices and empower patients and their doctors. I'm joined today by Lieutenant Governor Juliana Stratton, by the birthday boy, Senator Robert Peters, Representative Anna Mueller, Lurie Children's Hospital's Tom Shanley, who I mentioned, and also Dr. Denise Goodman, UIC's Dr. Shika Jain, IHA President A.J. Wilhelmy, MS Society's Cody O'Connor, and Leukemia and Lymphoma Society's Marilyn Zidlow. I'm very happy to say that last week a bipartisan majority in the Illinois House passed the Healthcare Protection Act, whose purpose is to make quality care easier to access for patients and to increase accountability among insurance providers. For far too long, insurance companies, not doctors, have determined what treatment options patients should have and how quickly they can receive it. This bill puts power back in the hands of patients and their doctors. The HPA starts out with a focus on utilization management. Utilization management comes in many forms, but it's seen most prominently in prior authorizations and step therapy. Prior authorization forces consumers to get the insurance company's approval before beginning treatment, even after their doctor has deemed the treatment medically necessary. And with step therapy, insurance providers can require patients to try and fail with often less effective treatment options and medications first before getting the actual care recommended by their doctor. These practices too often result in a denial of coverage for the treatment that's needed because insurance companies simply want to boost their profits. It's an unhealthy and an unfair system for patients. There's no question that medical professionals are best suited to make recommendations about treatment, not insurance company bureaucrats. So with this bill, we're requiring insurance companies to use the same treatment criteria to determine medical necessity that doctors do. That way patients get what they need. And we're banning step therapy altogether in Illinois for fully insured and Medicaid plans. Next, the HPA will make Illinois the first state to ban prior authorization when it comes to inpatient hospital setting mental health care. If you or a loved one are in a crisis, in the midst of it, you should not be forced to navigate difficult insurance rules and bureaucracy. When consumers are shopping for health care coverage, either individually or through employers, insurance companies ought to be transparent about prior authorization so you can make informed decisions when deciding on your coverage. That's why this bill demands that insurance companies publicly post every treatment that requires prior authorization. We're protecting consumers even further by prohibiting the sale of junk insurance plans, which don't even meet the minimum standards of the Affordable Care Act. 12 states so far have banned these scam insurance products, and it's time for Illinois to join them. The HPA also focuses on improving network adequacy. We're setting a standard for care availability, including appointment times and in-network doctors. Too often, patients find exasperating problems with in-network directories and the availability of listed providers. When a patient goes to look for a provider, the list may show doctors and specialists who no longer accept new patients, aren't any longer in-network, or sometimes don't even exist. These ghost networks make it hard for patients to locate care nearby without waiting weeks or months for an appointment. To combat this problem, our bill requires that insurance companies regularly update their provider directories to show the true availability of healthcare providers. Finally, the HPA continues our efforts to prevent insurance companies from gouging customers by unfairly hiking their premiums. Last year, the General Assembly and I ended these unfair rate increases for individual policyholders and the small group insurance market. HPA will now require the same for large group insurance carriers. In summary, the Health Care Protection Act is a set of consumer-focused health insurance reforms that will return more autonomy and control to patients and their doctors. This is about protecting Illinois families, making it easier and a little less labyrinthian to navigate the world of healthcare and insurance. I want to make special mention today of my partners in this fight. This bill's two outstanding chief sponsors, Senator Robert Peters and Representative Anna Muller, are champions for better health care for families all across our great state, and I'm so grateful for their leadership. When I delivered my budget address in February, I told you that I'd put my shoulder to the wheel to get this done, and I meant it. That's why we're here today. We're traveling to communities all across the state, to places like Belleville or Peoria, or Rockford, or Maywood, or right here in Chicago, to tell Illinoisans about this legislation. And we've delivered to doctors, patients, and consumers one message. This bill will save lives and lower healthcare costs for millions of Illinoisans. So with that, I'm very proud to bring to the podium the HPA's chief House sponsor, who did just an outstanding job on the floor of the House of Representatives and is somebody that we rely upon to make the case for HPA and does a terrific job representing her constituents, and that's the great Representative Anna Muller. Anna?
Good morning. I am truly grateful to be part of this effort and for the strong leadership of Governor Pritzker and his partner, Lieutenant Governor Juliana Stratton. Without their outstanding leadership, this bill would not be where it's at today. I'm also very happy to be joined with Leader Buckner from the Illinois House, and to be here with Lurie's Children's Hospital, with the doctors, staff, nurses, and families that are cared for here at this great institution. As Governor Pritzker mentioned, I am so delighted that we were able to pass the HPA on a bipartisan vote last week in the House. Governor Pritzker did an outstanding job describing why this bill is so important and why this bill is so necessary in our state. And as he unveiled it back in February during his State of the State, I was very pleased and honored to be asked to sponsor this bill in the House. I chair the House Human Services Committee, and this is where this bill first arrived in the legislature to be introduced to my colleagues and other representatives. We held a subject matter hearing initially to educate my colleagues on why this bill is so important. We brought in doctors, we brought in patients and advocates to talk about the challenges that we currently face right now in healthcare because of the barriers that are put into place by insurance companies to maximize profits over patient care. We heard from a doctor who works in an emergency room about the struggles that he faces when patients show up with severe mental health crisis and the need to have prior authorization before they can get treatment. We heard the anguish in his voice, having to tell patients that they couldn't be admitted, that they would have to work with their insurance company before they could receive care. And we heard of many instances where patients were turned away, with doctors not knowing what would happen to these people, whether they would be with fear that they would harm themselves or harm someone else because they were unable to get treatment. We heard from a young man who was lured by one of these short-term junk policies with low premiums but high deductibles when he was diagnosed with MS for the first time. He reached out to his insurance company thinking he would get coverage, only to be found out that they determined that to be a pre-existing condition, and they would not cover his treatment. Both of those scenarios, both of those practices would be banned under this legislation, preventing future tragedies like the ones that we heard about in our committee. And for those reasons and all of the other elements that are contained in this legislation, I'm so proud to be part of this effort. We're sending a great bill to the Senate. We have an outstanding champion in the Senate, Senator Robert Peters. I know he's going to do a great job getting this over the finish line, and we have a little bit of a wager on how many Republican votes he'll be able to get. We had 10 Republicans who supported this bill in the House, which was a great sign. I know he's going to be just fantastic in getting this passed, and wish him a happy birthday, and happy to call him to the podium. Senator Peters.
Hello, I'm State Senator Robert Peters, and welcome to the 13th Senate District. This district, which stretches from all the way up here down the lakefront to the Indiana border, is something special. And one of the things that makes it special is right here at Lurie's Children's. I'll tell you a little bit of a personal story. My younger sister had cancer when she was a kid, a preteen. And it was, at the time, Children's Memorial, but it was this hospital that saved her life. And now she has a kid, and I'm an uncle, and she's living a full life, and I'm just so thankful for this institution, for what it's done for my family. I'll just say, first off, amazing work by the sponsor, Rep. Mueller, and members of the House and the advocates for getting this bipartisan bill out of the House chamber. We are one step closer to bringing comfort and dignity to healthcare patients all over the state. Look, I'm no stranger to our healthcare system. I talked about my sister, but for myself, I was born hard of hearing. I had multiple surgeries throughout my life. I struggled with mental health issues. I have seen these struggles with my friends and family. And in my 20s, not too far away from here, I lost one parent to cancer and another to alcohol abuse due to her coping with her own mental health trauma. Like so many of my constituents, I know the anxiety and fear that comes with navigating our healthcare system, especially right now as my wife and I are looking to have children in the near future and are doing fertility treatments. It is hard enough trying to navigate the day in and day out of life, whether that is taking care of friends and family and taking care of work and home chores. It is understandable that a bunch of healthcare papers and policies can add even more anxiety to your life. I told you about this unique district that stretches from here downtown or in Streeterville all the way down through the south side to the Indiana border. It's home to large health systems, public health system, safety net hospitals. It is home to people who live across spectrums, particularly across race, class, and gender. But there is one thing that is nearly universal, and that is people who have felt pain when it comes to their health insurance. What we are doing here is fighting for you, the everyday Illinoisan. The everyday Illinoisan who wants to make sure their loved one or even themselves is receiving the best care possible. That when your doctor recommends a treatment, that is the treatment that you get. That when your child is facing a mental health crisis, they get a hospital bed that is filled with love, safety, and comfort. That finding a provider or a plan isn't a guessing game for your well-being and your wallet, and that you aren't fooled by predatory companies masquerading their junk financial scams as insurance plans. This bipartisan bill is coming to the Senate, and big-time insurance companies are going to do all they can to fight back against this. They're going to throw out every scare tactic in the book, but we have made it clear through this process that the door is open. And with advocates as well as with opposition to this bill, we have actually been able to take input to draft what has become a bipartisan bill with 81 votes in the House. We are bringing the people of Illinois with us to the negotiating table, and we will get this done, and we will continue to make Illinois a healthier and safer place. I guess if I have one birthday present that I would like to get this year, it's the Healthcare Protection Act. So I'll end on this. Nothing feels better than having an applause line. You know what I mean? You can have that more often. I'll end on this. I want to thank the governor. I am so honored to sponsor this bill, but I know I'm not alone. So many leaders and colleagues have worked tirelessly and personally to change and improve healthcare outcomes in the state. And when we get this done, it will have been all of us who have been committed to our constituents and ensuring they have the best care possible. And I'm proud to bring up someone who's going to share a very personal and deep story, a profound story, Cody O'Connor. Thank you.
Thank you, Senator. Hello, my name is Cody O'Connor, K-O-D-Y-O-C-O-N-N-O-R. I'm a resident of Harvard Heights and live with a disease called multiple sclerosis, or, as everybody knows, MS. For those of you who may not know, MS is an unpredictable, often disabling disease of the central nervous system that disrupts the flow of information between the brain and the body. Symptoms vary from person to person and range from numbness and tingling to walking difficulties, fatigue, dizziness, pain, depression, blindness, and paralysis. Early treatment of the disease is critical and minimizes disease progression. Prior to my diagnosis, I was a healthy, young male in my 20s who enjoyed running and outdoor activities. As a new small business owner, I set out to choose a health insurance plan with low premiums to ensure my personal finances could be directed towards investing in my business. I felt strong and I felt invincible. I thought all healthcare plans were comprehensive, and so while choosing plans, I browsed insurance websites and landed on Golden Rule, a short-term, limited duration plan offered under United Healthcare. To me, this plan was everything I thought I needed: a low premium with what seemed to be basic essential coverage. It was very quickly after signing up that I began to feel off, experiencing tingling in my extremities and other unusual symptoms. Then, on March 31st, 2017, my life was turned upside down. On that day, I was diagnosed with MS. Little did I know, however, that I was about to be delivered even worse news. With a deductible of $7,500, I had to pay for almost all of my diagnostic testing out of pocket. The bad news from the insurance company continued. While working to access my disease-modifying therapy, or also known as a DMT, to treat my MS, I received a notice that my insurance plan would offer no coverage whatsoever. They had classified my MS as a pre-existing condition, even though I did not know I had it while I was enrolling. As a result, I would have to pay for my $7,000 a month disease-modifying therapy medicine completely on my own. I was sent into debt due to predatory practices and false advertising of this, quote, insurance. These plans are dangerous. As evidenced through my story, they often fool younger, healthier individuals into a false sense of coverage. And they can impact the risk pools and premiums of traditional insurance plans. When I learned of the omnibus package, which would include a ban of the short-term limited duration health plans of Illinois, I was elated. Today, I applaud this passage of the bill in the House. It is now time to urge the Senate to act swiftly towards protecting people affected by chronic illness or disabilities to ensure their continued access to be more affordable, adequate, and understandable of their health care coverage. I know I'll be talking with my Senator Robert Martwick about his support for the bill, and I encourage anyone watching this to do the same with your state senator. I urge Senate to vote yes on the Health Care Protection Act. I would like to now pass it off to Marilyn Zidlow. Thank you.
Thank you, Cody, for sharing your story. Good morning, everyone. My name is Marilyn Zidlow, Marilyn Zydlo. I am a resident of Downers Grove and a mom to 3 sons. My family's life changed forever in the spring of 2020 when my youngest son, Jimmy, who was 17 at the time, came to me with complaints of a pulled muscle in his neck. He was a high school junior and a 2-sport athlete who played baseball and football. While I was concerned about the discomfort he was experiencing, I expected it might be related to training. Jimmy seemed perfectly healthy. No other symptoms, just a lump. Yet, after many doctor's appointments and tests, his doctor called on June 12th of 2020 with an update that completely shocked me. Jimmy had cancer, stage 3 advanced Hodgkin's lymphoma. When I told Jimmy, his initial reaction was denial, confusion, and fear, but he quickly decided that instead of feeling sorry for himself, he was going to fight as hard as he could as he entered the battle for his life. Little did I know I was about to begin a separate battle, one with the insurance companies. He began 12 rounds of very aggressive chemo. One of the side effects of the chemo was extreme nausea, which left him extremely sick, debilitated, and often bedridden for days. Thankfully, his doctor told me that there was a medication that could ease the nausea. I was relieved that anything could help. As you can imagine, watching your teenage son, who just months earlier was playing multiple sports and thriving, now so sick that I had to help him to the bathroom, was unbearable. My relief soon turned to confusion and anger when I learned that the only way to really get Jimmy access to the medicine would be for him to fail several less effective options first. So we did what the insurance company approved, different doses, different drugs, and after all of that waiting, he finally got the anti-nausea medication his doctor originally recommended, and it worked. But by this time, we were already halfway through his treatment. I now know that what Jimmy endured is called step therapy. As a mother, one of my most important jobs is to protect and care for my children. Imagine the helplessness I felt when the care I knew Jimmy needed was out of reach because an insurance company was trying to save a few bucks. No mother, no family, no child should have to go through what Jimmy and I did. Thankfully, Jimmy is now in remission. He's doing really well and is a junior in college studying biomedical engineering. But other kids and anyone across the state could be subjected to the same process that our family went through. This is why I'm thankful that the House recently passed an omnibus package that would effectively ban step therapy. I will be reaching out to my senator, Leader John Curran, to share my story and hope to be able to thank him for voting yes on the Health Care Protection Act. And I urge all senators to vote yes, ensuring that kids like Jimmy and anyone battling and living with chronic diseases like blood cancers can get the right treatment, the right way, without delay. Thank you. I'd now like to ask Dr. Goodman to the podium, please.
Hello, and thank you to Governor Pritzker, Lieutenant Governor Stratton, State Representative Moeller, and State Senator Peters for your leadership, support, and advocacy. My name is Dr. Denise Goodman. I am the Medical Director of Case Management and Care Coordination here at Lurie Children's, and I'm also a critical care physician. This bill promises to do so much for our parents and families and our patients to improve equity and access. One very important provision is that, as we've just heard, it prohibits fail-first step therapy requirements. This is a practice where a patient must first demonstrate that they have failed on one or more medications before they can be offered the definitive treatment, even when we know that it will work based on well-designed clinical trials. This can delay the child receiving the medications they need, and it exposes them to potentially ineffective therapies. I also appreciate that the bill covers the way insurers review the care we provide to make sure we agree on what is appropriate. It requires that they only use guidelines and professionally recognized organizations and other evidence-based criteria. There are subspecialty services here at Lurie Children's that simply aren't available anywhere else in the state. This bill ensures that our patients and their families receive the care that they need. Thank you for your advocacy on behalf of the children of Illinois. I'm now going to introduce A.J. Wilhelmi. He's the president and CEO of the Illinois Health and Hospital Association.
Thank you, Dr. Goodman, and good morning, everyone. I also want to recognize and thank Governor Pritzker for inviting me to join you today, and sir, for your excellent and outstanding leadership on this issue. I'd also like to recognize Dr. Tom Shanley, dear friend and board member of IHA. Thank you, Tom, for hosting us this morning, and also for your outstanding work in this important mission of Lurie Children's Hospital in service to the kids across the state of Illinois, certainly here in Chicago, but really, truly across the state of Illinois. So I'm here on behalf of our 211 hospital members, and I applaud the efforts of Governor Pritzker and his administration, as well as the bill sponsors, Representative Moeller and Senator Peters. We are so grateful for all of your efforts to advance this important legislation on behalf of Illinois patients and their families. We saw a significant bipartisan majority in the House of Representatives pass this bill just last week. And Senator, we know you got this in the Senate, and I want to echo everyone else and say happy birthday to you, sir. For years, we've heard from our hospital members that prior authorization, delays, and denials are a top challenge in delivering timely and appropriate health care, especially when it comes to critically important mental health services. And that's why IHA has welcomed the opportunity to work with the Pritzker administration on this proposal that would prohibit prior authorizations for inpatient mental health admissions for the first 72 hours and thereby ensure patients receive the specialized mental health care that they need and deserve. The hospital community also supports provisions in House Bill 5395 that would ensure healthcare professionals like Dr. Goodman are the ones making the final decisions when it comes to their patients' medical care, not insurance bureaucrats. Practices that allow an insurance company to override a physician's judgment, these are cost control strategies that benefit the insurance company's bottom line at the expense of the patient. This proposal places patients before profits by making sure healthcare decisions are made with one goal in mind, and that's to advance better patient care and ultimately better health outcomes. Governor, as you said today and in your State of the State address, we must put the power back into the hands of patients and their doctors. And this proposal begins the process of doing just that. So on behalf of our member hospitals, their healthcare workers, and the patients they are privileged to serve, IHA applauds the governor and the bill sponsors for moving forward with House Bill 5395. This legislation will empower Illinois' healthcare community to deliver the best possible care for their patients. And so now it is my pleasure and my honor to introduce the Lieutenant Governor, Juliana Stratton.
Hello, everyone. I'm Lieutenant Governor Juliana Stratton, she, her pronouns, and thank you for joining us. Dr. Shanley, and to everyone from Lurie's, thank you for the warm welcome. I'd like to start by thanking Governor Pritzker for continuing to prove that strong leadership doesn't have to sacrifice compassion. I also want to thank Representative Moeller and Senator Peters for leading the charge to advance this important bipartisan bill through the General Assembly. We're grateful for all of our partners in the General Assembly, including Leader Cam Buckner, who is here, who, along with Senator Peters, represents this district. Cody and Marilyn, I just want to thank you both for sharing your powerful stories. Those stories matter as we continue to do this work. Though America is struggling with division, we are united by at least one thing: a collective fear about the skyrocketing cost of health care. In 2022, a little more than 65% of Americans reported having private health insurance coverage. And we've already heard about the importance of Medicaid for so many families right here at Lurie. But having insurance doesn't guarantee that coverage will, in fact, cover you when you need it the most. Due to loopholes, sneaky coding, and sometimes just plain bad acting, it's hard to find many people who feel confident that their insurance provider has their best interest at heart. The work we're uplifting today marks the beginning of a new narrative in Illinois. The Healthcare Protection Act interrupts the status quo of predatory practices and instead returns power to patients and their doctors. But this is not just about access. It's also a matter of equity. A 2022 study of cancer patients found that Black patients were 3 times more likely to have been denied health insurance because of their diagnosis than white patients. We cannot allow any system to function in a way that deliberately leaves people out, and I'm grateful for the IHA and the dedicated health professionals who are here today standing with us in this fight. And by the way, as a mom of 4, I can tell you from a personal experience that when your child is having a medical emergency, the very last thing that you want to spend your time doing is convincing a faceless analyst at an insurance company that your doctor is right and that your child's treatment is necessary. I am beyond proud to be a part of an administration that values humanity and health over profit. Thank you. And with that, I'll end by saying happy birthday, Senator Peters. And I'll pass it back to the governor to answer any questions from the media. Thank you.
Before I begin, I'll take questions from the members of the media. I just want to acknowledge someone who I forgot to acknowledge at the beginning of my remarks, and that's a great state representative I get to work with in Springfield, Cam Buckner. And Charlie.
Governor, is there any concern that with a bill like this in place, we could see less care offered to Illinois residents, insurance companies perhaps not serving the state because of these regulations?
No, I think that what you'll see is better care and lower costs. Remember, many other states have a regime like we're suggesting that we're going to put in place, for example, to make sure that insurance companies aren't gouging people in their premiums. So this is not a new thing in other states. It would be new to Illinois and to patients in Illinois. That's one aspect of it. And the other is, of course, this is just, I think, reasonable, and insurance companies can still do good business, collect premiums, and do well in Illinois without having to force patients to take step-down step therapy, where people are having to fail first was a term that I hadn't used before, but I like that term, where you have to fail first before you actually get the treatment that your doctor knows you need. So I really think this is good for doctors and patients and reasonable for insurance companies to accept.
Yesterday on the Bears Stadium, you said that there were some non-starters in the proposal. Is the liquidity fund proposal one of those non-starters?
Look, every deal, and I'll put quotes around that, because we're talking about taxpayer dollars here, but every deal has a lot of features to it, and you put them all together when you're considering whether to accept the deal or not. So I think from my perspective, the deal that was presented didn't take into account that taxpayers really aren't going to do well under that proposal. So saying that there are non-starters is just, from my perspective, trying to highlight that there are things about this that don't make sense for taxpayers. And we're certainly going to look at every aspect of it. One that I mentioned yesterday is whether taxpayers will actually get the revenues that come from the other performances that occur at a domed stadium like this. And I just want to clear up one other thing. I'm a Bears fan, and I want to see a domed stadium in the city of Chicago. But again, the question is, who's paying for that? And it seems to me that the team owner who benefits most ought to be the principal provider of the capital. And when I say principal, I mean vast majority of it. And the taxpayers, to the extent that they're putting anything up here, should be getting a return on the investment that they're making.
Governor, is there something you'd like to see that would change your mind about this in particular?
I'm going to leave that to conversations that we'll have going forward. I'm sure that the Chicago Bears will come talk to my staff and to me and to members of the legislature more than they have already, and understanding that what's been put on the table now is not good enough. And again, we're all stewards of the taxpayers' dollars. We want to handle those carefully and well, and again, get a good return for taxpayers' investment in this. And so I look forward to any conversations that will occur on this, and I don't want to try to negotiate here in public and on camera and in an inappropriate setting, I think, for that. But look forward to any conversations that'll ensue.
Senator Peters, if we could ask you put out a statement this morning on the Bears Stadium. As someone who's going to have to vote on this at some point, perhaps, what are your thoughts?
Well, I'm a Bears fan. I grew up as a Bears fan. Of course, I want to see the Bears in the city of Chicago and want to see the Bears succeed. I will just say that before I was even a state senator, I was a community organizer, and oftentimes I thought, when it comes to folks who have sports teams, they often come and they make a lot of promises. I don't know of any stadium deal that's ever lived up to those promises. But I will say I'm glad that the Bears, have shown that they'll put some of their own money in there. That's a really good first step, and we'll just go from there. And again, I think just in terms of public money, just being extra careful and being as clear as possible to make sure we do the best for the people of the city and particularly people of the state.
Since we're all here.
Thanks, Charlie. Well, I'll say first off, my one real beef with the Bears is for 18 years in a row, they have not drafted me in the first round. And so last night was more disappointment. No, I would just echo what the governor and Senator Peters said. We've had some really tough times, and we've done some tough things when it comes to finances here, right? And we've had, 8 credit upgrades and 9 credit upgrades and 6 balanced budgets, and paying back a backlog of debt and bills here. And so we've got to be smart and prudent about how we move forward. I've been very clear about the fact that I want the Bears to stay in the city, to stay in the 26th district if possible. But we've got to be skeptical and optimistic at the same time. And so this is just a proposal from what we've heard. we'll have more conversations in Springfield moving forward, but keeping the financial stewardship of the state centered around what people need, it has to be the main ingredient here.
I'm sorry, I'm just going to add one more thing because I can't help myself. No, I just want to remind you that, again, we're willing to have these conversations, but I just remind you, we have a lot of priorities to meet the needs of working families across Illinois and to meet the needs of people who need our help, right? And Illinois has been, for many years, we haven't been able to meet those needs. We're getting to a point where we finally are. And we talked about credit upgrades and balancing the budget. That's all part of the process of getting to where we can help people more than we have and live up to our obligations. And so when I think about, where a new stadium or multiple stadiums sit in the, in the list of priorities for the taxpayers or for the people of Illinois, it feels like it's not in the top, tier of those things. So again, that's the context in which conversations will occur with the Bears, with the Sox, with the Red Stars, and others that may want to come forward and talk about capital that they'd like the taxpayers to put up. So, thank you.